So we welcome 28 more Cuban doctors to assist in Gauteng's response to the COVID-19 outbreak. This now brings the total to 215 healthcare workers who arrived from the Caribbean nation on the 27th of April. It takes most foreign-trained doctors months to register to work in the country. However, the Cuban doctors were cleared within a matter of days, and this has raised some concerns. We speak now to health journalist from the Bhekisisa Centre for Health Journalism, Aisha, Abdool, Karim. Thank you very much, Aisha, for speaking to us. Perhaps let's start with a case study that you spoke to and what his experience was like in terms of trying to get onto the system here in the country.
Yeah, sure. So when we were doing this article and we did another article previously on this topic, we spoke to several different foreign trained doctors. So these are not just foreign nationals, but I think it's also important to note, like, some of these are South African citizens that couldn't get spots here in South African universities because there are so many limited places for medical school here, and so they've gone abroad. And in particular, one that we spoke to had also done a survey, and so he had not been able to get admission to any South African universities like many of these other doctors, and so had gone abroad to study in China and obtain his medical degree. And when he returned, it took him several months to go through the whole registration process. And during this pandemic, he undertook with a few other colleagues to do a survey, and they found that this was the case for not just him, but hundreds of other foreign trained doctors that were here in South Africa trying to find a way to assist during this pandemic and trying to assist in the response, but were unable to move through the registration process that would allow them to practice in hospitals and assist in the response in that way, because it is such a lengthy process, and a lot of them can be there from anywhere from a few months up until 2 years, because that's just how much it differs on a case-by-case basis.
And what happens during that time?
So there are several different steps, and again, because it's not a very streamlined process, it can differ quite widely from individual applications. But the first step is very important, and that's that your university qualification needs to be recognized by not just the Health Professionals Council of South Africa, but also there's an external US validation system that needs to also take place, and then there is a Department of Health application that also needs to be processed. So even before you get to like the second step of the process, your degree needs to be validated. And if your qualifications are not recognized, doctors then need to sit for these board exams that the council has designed. And the exams have two components. The first component is has recently switched to being an online component, and then the second component is a practical component, which takes place at various universities that have agreed to be part of this process. And a lot of the holdup genuinely takes place around the exam, because there are only 2 opportunities a year that people can sit to take this exam. And so that was creating quite a backlog in the system, because there's limited spots available. People were waiting to try and do the exam. And then, all of that kind of got exacerbated recently during the lockdown, because people that had sat the last exam, which took place in January, were unable to get their results until recently a few weeks ago, the results finally got released. And so without those results and without the board exams, their registration can't continue. So the HPCSA, which is the Health Professions Council, can't continue their registration process until they have passed the board exams, both parts of it. And then without that registration, basically it's impossible for a doctor to practice, or not just doctor, any healthcare worker to practice in this country without registration through the council.
Finally, for us, we are made to understand that you can apply at HPCSA vetted international medical schools. What do we know about the public list of those schools where people can see and get those options?
So that's been another huge problem, is that, 2 years ago, the HPCSA was meant to make this list publicly available so that students could make a decision on where they were going to study, knowing which universities were recognized and which universities weren't recognized. At this point in time, the only universities we know for sure are recognized are universities that are part of the Mandela Castro program, where South African medical students do complete part of their studies in Cuba. And that's also why the Cuban doctors were able to complete their registration process so quickly, because that curriculum had already been validated. Meanwhile, the HPCSA has not yet publicly made a list available or any kind of criteria available to let students know, or not just students, but other foreign trained doctors know which qualifications and which universities they recognize, which is also what causes a huge backlog, because the validation is done basically on an applicant by applicant basis, which further causes a delay in terms of registration.
Let's leave it there. Thank you very much to Aisha Abdool Karim. She's with the Bhekisisa Centre for Health Journalism.